Spark's done a great job helping our staffing challenge by automating a number of processes. And I'll give two good examples. One is we always talk about on the clinical side of the house, we want nurses and doctors to work at the top of their license, top of their skill set, meaning I don't pay them to sit at a computer and click buttons or sit there and watch patients. They need to be treating patients, keeping people healthy. On the revenue cycle side, we've always had a deficit that because there's so many manual processes, we have a lot of people we hire with great skill sets that just sit there and button mash over and over all day long. We hire them, we get them excited to work for a hospital like ours, tell them about our mission and all this, and then sit them in a cube and say, okay, now click the tab key 18 times every time on this. And that's all you're going to do 8 hours a day for the rest of your employment with us. And so for one thing, it helps with staff retention because they get to do more enjoyable things. They're not sitting here just clicking away every day just because that's the way the system's designed. They can focus on the higher process things or working with payers or working on things that actually bring in cash and not, well, the system's built this way, so I have to do this task. That's number one. But number two is absolutely by automating functions, we would never fire someone based on that, but we have not had to add staff at nearly the same rate because we're able to say, I don't need to have 3 people who do this job anymore who, work our $0 accounts because Spark Automation already closes them out. No one has to touch those anymore. We can redeploy staff to do other things. So it's a big, big, big staff benefit. And it's also great when we hire people now to say, again, I'm not sticking you in a cube and just having you button mash for the rest of your time. You actually get to focus on things that tie to revenue cycle, that go after payers, that go after revenue, that help our patients.